Heart disease. It claims 1 in every 7 lives in the U.S. And of that, 1 in every 3 women will die from heart complications. We're going to change those statistics. At least that's what we're hoping to do. Today we're focusing on women and heart disease and steps that every woman can take to help reduce their risk. So we're here with Dr. Cardi Taub, Cone Health cardiologist and medical director for the Women's Heart Health and Cardio Obstetrics Clinic. So we are talking to you about what every single woman needs to be talking about and thinking about right now, which is women and their heart disease. So at what age should a woman start making their heart health a priority?
Thank you, Tanya, for having me. I'll say they should start today. I think every adult woman, even as a teenager, should start with a healthy journey on how they take care of themselves in terms of their heart health in what they eat. Because the thing about it is 80% of heart disease is preventable. So I would ask every woman to start looking at their heart health today.
Okay, well, so you guys are kind of helping women do that. Cone Health is offering a free community event for women all about heart and heart health. So tell us about that event, when, where, and the whole thing.
Oh, we're looking forward to this. It's going to be on February 2nd, and that's going to be at Union Square, Gate City Boulevard. We have been doing this for several years now. This is our 3rd year, and we look forward to that on National Go Red Day, which is the first Friday in February, to get women together of all ages, socioeconomic backgrounds, to just talk about what it is to be able to take care of your heart, what you need to do, what are the preventative measures, because I said 80% of what happens in heart disease is preventable. So on February 2nd, we'll be looking forward to that.
Okay, so what happens when people go to Union Square? What will they find?
So what's going to be, I'll give you a quick rundown of the day. What was going to happen in the morning, we have sessions from some of our cardiologist colleagues, some of the pharmacists who are going to come by and talk about high blood pressure, what can you do, talk about nutrition, talk about stress in the heart, and just how you as a female can really take care of yourself to prevent some of these. The afternoon is going to be exciting. We're going to have short classes, sessions that people can really pick their own path, where you can either do a cooking demonstration or you can learn about a calcium score test that we usually look at for preventing heart disease and understanding what's your risk for heart disease. Or you can take the path where you do exercise classes with our friends from Sagewell. So it is an exciting day to look forward to.
Okay, do we need to register ahead of time, and do we do that online?
So yes, so the great thing about this is we have the registration online. People can be able to pick their timing. Most of the great activities in the afternoon, you can come in because the seat is limited. The morning sessions are limited on seating, so there may be restrictions there if someone does not get to it in time for registering. But yeah, this is going to be an exciting day. The one thing that we're looking forward to on that day is to empower women, to help women understand that you can actually take care of your heart health by just knowing what you need to do, knowing your numbers, understanding your family history, knowing what the healthy tracks are that you can take and make your life a healthier pathway as you go forward.
Yeah, because it seems overwhelming at the get-go, but you're going to put it in bite-sized chunks so that we'll be able to figure that out by the end of the day. Okay, so women's bodies, they go through all kinds of unique changes throughout time. So during and after pregnancy, menopause, could these stages and changes impact their hearts? What should they be looking for?
You're exactly right, Tanya. The stages that women go through, starting from their premenopausal years and through their years of women who get pregnant, there are some things they get exposed to during pregnancy. For example, if they have high blood pressure during pregnancy, diabetes during pregnancy, those predispose them to early heart disease. So these are the things that women need to start looking at when they've had these experiences during pregnancy. Of course, menopause have had some takes on the traditional ways of how people, when you lose certain protection and you also have high blood pressure, diabetes, can lead to high risk factors for heart disease. Well, those are some of the things we're going to be talking about on February 2nd, really, to help people understand what the steps you can take for early detection and prevention, and how do you live with heart disease if you have heart disease. This is not just for women who want to prevent, women who already have heart disease. What do you do? How do you really take over your life with having high blood pressure? What are the things that you can do to help control it? So yes,
okay,
those are the steps.
So It's exciting that people can go to this event now. If you can't go to the event, we're going to do kind of like a mini event right here, right now. What are some symptoms of heart disease in women that many times women think are just related to something other than their heart?
So when we think about heart disease, the typical symptoms we all think about is chest pain. Some people think about shortness of breath, but I would like to remind women that are listening to us today is you're not just only going to experience chest pain. It can come in a form of the fact that you've been tired for a couple of days. You just can't do the things you used to do. You feel dizzy or lightheaded. One of the most important things is knowing what your baseline is, meaning how are you every day. When you start to go a couple of days that's outside of your norm, please talk to your primary care provider. Please talk to someone because you could be really harboring something that could be devastating for you, like a heart disease, a heart attack, or something like that.
I think we pass that off because we're like, it's just been a rough week. We've just had a lot of stuff going on.
Of course we do, because we're busy. We take care of everybody else. We have to get the kids to school. We have to make sure we get to work. We got to make sure our projects are in. But we have to step back and really appreciate the fact that we need to empower what we need to do for ourselves. We need to make sure that we're fine because we can't take care of everybody else if we're not doing well ourselves. So that's the one thing I think women, we need to understand that it's not tomorrow, it's not next week, it's not after I give my project, it's actually today. I don't feel good today. I'm going to stop and I'm going to take care of myself.
All right, and we're going to kind of talk about how you can do that on that day when you feel like that instead of like trying to make an appointment that's like 3 weeks out from now. We're going to talk about that when we come back after this break.